Now let's welcome Shannon Mathis, nurse practitioner at Novant Health Gastroenterology, Brunswick. Thanks so much for being here today.
Thanks for having me.
It's been ages since you've been here.
It has.
I think we just figured like 3 years or something.
Yep.
Too
Almost
long.
3.
Too long, Shannon. Too long. So, what in the world interested you in gastroenterology? Because you used to be in plastics.
Right. So I did some nursing and plastics and some med surg, different things with nursing. But I think at some point in time, everybody's kind of had some experience with a GI bug at least, or, some exposure to nausea, vomiting, diarrhea, or something like that. But for some people, those things become chronic issues. And being able to help people improve their quality of life and dealing with those issues is really what drew me to GI.
That's nice.
Yeah.
So you're at the clinic at Novant Health Gastroenterology. So tell me a little bit about your clinic and your role at that clinic.
So right now we have 2 doctors, Dr. Andrews and Dr. Futch. It's myself and a PA, Dottie Truax. So we are all there seeing patients. I see patients in the office primarily now, and so that's my day-to-day. And we're just a really tight-knit group of people that really value high-quality patient care.
It's a nice clinic. And,
yes.
the physicians there are really nice too.
Yeah, we're nice to have them. They've joined the practice this past summer, so they've really helped round out the group nicely.
Yeah, that's great. So let's talk a little bit about the endoscopy center and what services are offered there. And that's a great place, by the way.
Oh yeah, so it's really nice. Been open for coming up on 4 years, I believe now. So freestanding endoscopy center. So not all of our patients have to come over to the hospital for their procedures, which is nice. Little caveat though, not all patients are eligible to have their procedures at the endoscopy center due to some medical issues, anesthesia requirements. But we offer upper endoscopy and colonoscopies that can be done next door. So the endoscopy center is attached to our office, so everything's there kind of in one place, which is nice. It's a little smaller setting, and that's all that we do there. So
it's quiet. You don't have all that hustle bustle.
I think
in the OR.
Very welcoming. Just a little less stressful environment for people to be
because that's a stressful procedure.
Right. I think people just get kind of nervous about that.
Yeah. Well, it's the prep.
Yeah. Right.
Well, that's a great overview. And I think next we're going to talk about acid reflux. I hear everybody say, I have acid reflux. What does that mean?
So I think, some people have acid reflux or heartburn kind of used interchangeably, Some people never experience that. Some people experience that more commonly, sometimes daily. Acid reflux or heartburn can be when acid from the stomach comes up into the esophagus and causes kind of a burning sensation in the chest. Or some people have a burning sensation in their upper abdomen. Some people have kind of a sour taste in their mouth or can kind of regurgitate food or things like that. And it can be triggered by diet, so certain things, spicy things, Italian kind of foods like red sauces, citrus things, alcohol, that kind of stuff.
How about medications? Can something like ibuprofen or something like that?
Right. So yeah, for some people it can, especially if you're overusing.
That'd be me.
Right. Some people don't have that issue, but more people, I would say than not, can be prone to some irritation from like ibuprofen or NSAIDs in general. Like BC powders, Goody powders, that kind of stuff.
So how does acid reflux versus GERD? What is GERD? Is that different or is that the same?
Symptoms are really similar, but I'd say GERD is more of a label that is used when acid reflux symptoms happen more frequently. So if you're having acid reflux symptoms more than 2 or 3 times a week, then you kind of get that GERD label. If you're having more severe symptoms, that you have the heartburn or the reflux with a nausea or vomiting or abdominal pain that comes with it.
Do you treat them the same or?
We typically start treatment with the same. Our mainstay of treatment is trying to eliminate the triggering factors. So if we know that there's a food or a medication like you mentioned or alcohol that may be triggering, we try to eliminate those things and see if symptoms improve. Sometimes, especially if people carry some weight in their midsection, we try to encourage weight loss or just changing timing of meals can help. So we try diet and lifestyle modifications first, but some people do need medications like proton pump inhibitors and things like that.
So if you have one of those, how do you know when to seek help at a provider's office?
I'd say if you're having symptoms that are not responsive to, the change in diet, changing the timing of your meals, and staying up later after you've eaten your meals, that kind of thing. If you're not getting improvement, or you're having that nausea, vomiting, or trouble swallowing, or that kind of thing, you should see a provider.
The last time you were here, we talked a lot about irritable bowel syndrome. That's hard to say. Or inflammatory bowel disease.
Right.
Are those the same?
So they're different. They're very different.
Really?
So irritable bowel syndrome, or IBS, is characterized, it's very different from person to person. And so some people have abdominal pain, some people have diarrhea, constipation, or a mixture of those things. And that can kind of wax and wane, those symptoms, and can be caused by dietary things for some people, can be related to stress, anxiety, depression, those kinds of things. There's a very strong connection between our guts and our brains, called the gut-brain axis. And so if we're experiencing some increased stress or anxiety, it can manifest with some GI symptoms. Whereas inflammatory bowel disease is more an autoimmune condition and a chronic condition that most people present with diarrhea, that they may have some bleeding in their stools, abdominal pain, and is treated differently with medication and a little different workup.
Well, this is March, and it is Colorectal Cancer Awareness Month.
Yes, ma'am.
So let's talk a little bit about that. Let's talk about colon cancer and how prevalent that is in this area.
Right. So colon cancer is becoming more common. We're finding it in more people, and there was actually a change in the recommendation for colon cancer screening last year. We have a couple of options for colon cancer screening, but we do still recommend colonoscopy as the gold standard.
Well, that other option you just mentioned, that's the one I hear on TV with the box and the. So, how accurate are those, or do we have any data on that?
There's some data that's been collected, but there's some room that shows that there are some false positives as well as false negatives on those kinds of tests. I believe the current numbers are about 12-13% on both sides, so false positive and false negative on those kinds of tests. So they do have some room for error, much like lots of other testing, but colonoscopy allows us to directly visualize the colon, also allows us to remove any potential polyps that we may find. So it's the only test available that allows us to truly prevent colon cancer, because if we're removing those polyps, then they no longer have the potential to continue to advance into a colon cancer. And none of those home tests, allow that option.
The polyps, those are sort of a pre-cancerous
They can
type
be.
thing?
So there are different kinds of polyps, some are precancerous, some not. When we're doing the colonoscopy, we don't know just by looking at them if they're precancerous or not, so we remove them and send those to the lab to determine if they are or are not.
Probably if you're having symptoms, then you should have a colonoscopy.
Most definitely you should have a colonoscopy if you're having any symptoms.
So are you taking new patients?
Yes, ma'am, absolutely.
And how might our viewers make those appointments?
If anyone is in need of an appointment, they can simply contact the office. We don't require referrals for appointments. Some insurance companies may require referrals.
Yeah,
so, if that patient's specific insurance company requires a referral, they can simply ask for one from their primary.
And can they make an appointment with you?
Yes, ma'am.
So for their first appointment, that'd be fine. They can
Yeah, absolutely. Yeah, and we can talk about, if they have any specific needs or any symptoms going on, we can address those. Or if they're simply in need of a screening colonoscopy.
Yeah, great.
Yeah.
Well, thank you so much. Don't wait 3 more years to come back. And it's been a pleasure to have you.
Thank you
do a
for
great
having
job.
me.
Thank
I
you so
appreciate
much.
your help. Thank you.